A nasogastric or NG tube is a thin, flexible tube that is inserted through the nose, down the esophagus, and into the stomach. Imagine a drinking straw taking a shortcut to deliver medicine or food directly to the stomach. NG tubes are common in healthcare settings and serve a variety of purposes. They offer a lifeline for patients who are unable to eat or drink normally. One primary use of NG tubes is to deliver nutrition and medication directly to the stomach. This is especially crucial for patients who have difficulty swallowing, are recovering from surgery, or have conditions that affect their ability to eat. Think of it as an alternate route to ensure the body receives essential nutrients. NG tubes are also invaluable for decompressing the stomach. In cases of bowel obstruction or when the stomach needs to be emptied, NG tubes can remove air, fluids, and gastric contents, providing relief and preventing complications. Just as a pressure cooker releases steam, an NG tube can release pressure in the stomach. Beyond nutrition and decompression, NG tubes aid in diagnosis. They allow healthcare professionals to obtain samples of stomach contents for analysis, aiding in the diagnosis and monitoring of various gastrointestinal disorders. This is akin to taking a peek inside to understand what's happening. Before beginning the insertion, gathering the necessary equipment and preparing the patient is crucial. This includes gloves, lubricant, a syringe, tape, and a measuring device. Explaining the procedure to the patient in simple terms can help alleviate anxiety and ensure cooperation. The actual insertion involves several steps. First, the tube length is measured from the tip of the nose to the earlobe and then to the xiphoid process, the bony prominence below the breastbone. This ensures the tube reaches the stomach. The patient's head is then tilted back gently, and the lubricated NG tube is inserted into the nostril, advancing it slowly and steadily. As the tube reaches the back of the throat, the patient is instructed to swallow or sip water through a straw. This action helps guide the tube down the esophagus and into the stomach. Resistance or coughing may indicate the tube is entering the trachea or windpipe, in which case the tube should be withdrawn slightly and repositioned. Confirmation of proper placement is essential before using the NG tube. This is typically done by attaching a syringe to the end of the tube and aspirating or withdrawing a small amount of stomach contents. The contents can be tested for acidity using pH paper, which turns a specific color in the presence of stomach acid. Throughout the insertion process, several safety precautions must be taken to minimize risks and ensure patient well-being. First and foremost, maintaining strict hygiene is paramount. Wearing gloves and using sterile equipment helps prevent infections. Monitoring the patient's vital signs, such as heart rate, blood pressure, and oxygen saturation, is crucial throughout the procedure. Any signs of distress, such as difficulty breathing, changes in skin color, or significant changes in vital signs, should be addressed immediately. It's important to note that NG tube insertion should only be performed by trained healthcare professionals. Attempting this procedure without proper training and experience can lead to serious complications. This is not a DIY task. Once the NG tube is secured, ensuring the patient's comfort is key. The tube can be taped securely to the nose to prevent accidental dislodgement. Regularly checking the nostrils for signs of pressure or irritation and applying lubricant as needed can prevent discomfort. Proper placement of the NG tube must be confirmed before each use. This can be done by aspirating stomach contents and checking the pH as described earlier. Additionally, an X-ray can be obtained to confirm the tube's position in the stomach, especially after the initial insertion. Understanding the purpose, steps, safety precautions, and comfort measures associated with NG tube insertion is essential for providing safe and effective care. By adhering to these guidelines, healthcare professionals can ensure the well-being of their patients while maximizing the benefits of this common medical procedure.